Mrs. Tubbs passed her weaning trial. She was extubated to a 2 liters per minute nasal cannula. Almost immediately, she started breathing really fast. She was tachypnic and her oxygen saturation dropped to 82%. So, upon assessing her and taking a closer look, um, it looked like she was performing rapid shallow breathing. Um, so, if I collected an arterial blood gas at this point, I would expect to see some changes. So these were the normal values I showed you in an earlier video for a patient with COPD. If that patient is performing rapid shallow breathing, the pH will become even more acidic than it already is. So this first number will become lower, and the CO2 value will increase because she will not be effectively removing CO2 from her lungs. And her oxygen saturation will continue to drop because she's not going to be taking in enough oxygen to get into her blood effectively. I showed Dr. Nose her ABG values, and he decided that she needs to be put on immediate BiPAP therapy to help with her spontaneous breathing. So to fit Mrs. Tubbs with a mask, I would use this insert. It comes with the Respironics mask. It's attached to the bag, and you just place it over their face like this, and you want to be able to find the best fit. This one is too small for her face. It kind of covers her lip a little bit. This one fits her perfectly, and this one is too big. So I would find a medium mask for her. I would want to take into consideration if she's claustrophobic, I wouldn't want to put a full face mask on her because that might make her anxious. If she breathes through her mouth, which she does, I would want to use a full face mask instead of the nasal prongs because she won't get a good seal that way. Initially, I put Mrs. Tubbs on an IPAP of 10 and EPAP of 5, a rate of 12, an inspiratory time of 1 second, and a rise time of 0.1. I'm recommending these settings because we have a protocol that says there what you start them out on. I think they're going to match nicely with the way she breathes on her own, so it'll help her rid her body of CO2 and keep her comfortable. The high pressure alarm you set at 5 above, so it's at 15. The low pressure is at 5 below, which is 5. The low P delay and the apnea are both set at 20. I set the low minute vent at 4 liters per minute and the high rate at 30 and the low rate at 8. To monitor Mrs. Tubbs while she's on the BiPAP, I would get an ABG 30 minutes to an hour after placing her on the BiPAP to make sure that her values are moving in the right direction. I would also make sure that her level of consciousness is appropriate. She should be less obtunded than she was when I placed her on the BiPAP.